Committee reports. I believe that Elizabeth has 4 this morning to share with us, so you can pull those up and follow along. Thank you, Elizabeth.
Publications tab, and you'll find at the top of the list in bold publications for the 2023 legislature, and then the interim committee reports link is currently the 3rd bullet point. So as the reports are published, the web page is updated with those current reports. So the first report I'm going to start with is report of the Healthcare Stabilization Fund Oversight Committee to the 2023 Kansas Legislature. This committee annually reviews the operation of the Healthcare Stabilization Fund, reports and makes recommendations regarding the financial status of the fund. The committee requested its report be directed to the standing committees on health, insurance, and judiciary, as well as the appropriate subcommittees of the standing committees on appropriations. There are 2 central items identified by the committee. 1, whether the committee should continue its work, concluding yes, it should, and 2, whether a second independent analysis of the Healthcare Stabilization Fund is necessary. It concluded that it is satisfied with the actuarial analysis presented and it does not need to request a second independent review. This committee considered information presented by the Board of Governors representatives, including its required statutory report, the board's actuary, and the healthcare provider and insurance company representatives. The committee acknowledges its role to provide oversight and monitoring of the HCSF, including legislative actions and other contemporary issues affecting the soundness of the HCSF. The committee highlighted 5 recommendations and comments. Actuarial report and status of the HCSF, income and rate level indications. The actuarial report indicated calendar year 2022 was a generally favorable year, with the fund's position as of June 30th, 2022, slightly better than forecasted. Loss experience was better than anticipated, and assets as of December 31st, 2021, $14 million more than assets reported at the year-end 2020. However, investment income flattened out, and there was a high surcharge rate for the hospital and nurse midwife provider classes. The Board of Governors elected to make no changes in provider rates for calendar year 2023. Second, implementation and impact of the 2021 House substitute for Senate Bill 78. The committee separately acknowledges the impact of the increased coverage requirements on the self-insurance programs for the University of Kansas, faculty and foundations, and the residence and training program. With the coverage amounts increasing, first seen in fiscal year 2024, pursuant to this 2021 law, the committee notes the likely corresponding increase in settlements and attorney fees and expenses. Marketplace conditions and headwinds. Among the ongoing and emerging items contributing to the overall hardening of market conditions nationwide, the committee cites medical malpractice claim severity, including the frequency of large verdicts, concerns within reinsurance program with the withdrawal of reinsurance capacity, and the rate inadequacy for primary insurer rates due to the continuing consolidation of the healthcare market. On the state level, the committee notes with the open question following the 2019 Hilburn decision regarding whether the cap on non-economic damages is constitutional as it applies to medical malpractice actions, and a related consideration of the cap on wrongful death damages. Also noted were changes to the scope of practice for advanced practice registered nurses and expanding prescribing authority, as well as law related to the corporate practice of medicine. Fourth, COVID-19 impacts adult care homes liability concerns, medical care facilities. The committee notes the testimony presented regarding COVID-19 related claims, with some 40 to 50 pending cases, most of them filed against nursing facilities, and acknowledges the resources, expense, and time needed for discovery and ultimately for defense of such claims. The committee noted the market conditions exacerbated by the COVID-19 pandemic on nursing homes and the corresponding increase in nursing facilities participating in the home care provider insurance availability plan, with only 8 facilities seeking insurance in the plan in 2019, meaning they were unable to secure insurance coverage in the commercial marketplace, and 58 facilities seeking such coverage in 2022. The committee will continue monitoring these concerns, including the availability of liability coverage and staffing and supply chain challenges. Last, the fund to be held in trust. The committee continues to be concerned about and is opposed to any transfer of money from the HCSF to the State General Fund. The HCSF provides Kansas doctors, hospitals, and the defined healthcare providers with individual professional liability coverage. The HCSF is funded by payments made by or on behalf of each individual healthcare provider. As set forth in the Healthcare Provider Insurance Availability Act, the HCSF is required to be held, quote, held in trust in the state treasury and accounted for separately from other state funds, end quote. And there were no items of proposed legislation from that report. Next up is 2 special committee reports. First,
Elizabeth.
oh, yes.
Hang on just a second. Let's stop right there. See if there are any questions on the Healthcare Stabilization Fund report. Senator Stephan.
Thank you. We're usually talking about the concern of money being moved to the State General Fund. Has that been occurring, or has money been moving the other way, or where did that statement come from?
I will have to check and find out.
Any others? Seeing none. Thank you. Please proceed.
So this is the report of the Special Committee on Workforce Development to the 2023 Kansas Legislature. This committee was directed to study workforce development and laws or regulations that may act as barriers to entry into the workforce. They met twice in fall 2022. The report lists 19 recommendations for consideration, but did not have any items of proposed legislation. The recommendations generally fall into these categories: training, education, recruitment, and funding of the education for in-need careers, seeking areas of innovation that will encourage the recruitment of employees to Kansas, removing barriers to re-entering the workforce, staying in the workforce, or both, and obtaining licensure, and identifying and supporting career pathways, especially for students.
Any questions? And I'm sure that everyone is going to be hearing more about workforce development issues in other committees as that kind of permeates all areas of our state at this time. But I was on that committee, and yeah, that pretty well sums up the areas we're looking at and in competing with other states for talent and how to attract that to Kansas. So are there any questions for Elizabeth at this time? Seeing none, please proceed.
The third report is the report of the Special Committee on Intellectual and Developmental Disability Waiver Modernization to the 2023 Kansas Legislature. This committee was to review and recommend options to modernize the intellectual and developmental disability, or IDD waiver, and its structure in an attempt to address the IDD waiver, waitlist, and workforce struggles, and utilize a working group structure similar to the 2021 Special Committee on Kansas Mental Health Modernization Reform that is facilitated by an independent third party. And it was noted the Legislative Coordinating Council authorized the Special Committee on Home and Community-Based Services IDD waiver to meet during the 2021 interim. Utilization of the working group structure was one of that committee's key recommendations. This committee met 3 times in fall 2022. The report includes the committee activities as well as a review of the history of the IDD waiver, which began in 1974, a nationwide overview, an overview of roundtable discussions, and agency and stakeholder information on the waiver. The committee also heard presentations on the workforce for this population, the IDD waiver waitlist, assessment tools, as well as the roundtable discussion. The committee generally agreed the state should pursue a community support waiver and listed 7 recommendations for consideration, but did not have any items of proposed legislation. In the recommendation, the committee sought fiscal impact statements from the Kansas Department for Aging and Disability Services for each service discussed as a possibility to be included in the community support waiver, a $20,000 annual individual cap on the community support waiver, and that the community support waiver include individual budget authority across all services. The committee also recommended that the executive branch transition the Medicaid managed care system, CanCare, to a 1915B waiver from the current 1115 waiver, that KDHE and KDADS continue their study on strength-based assessment tools. KDADS provide an estimate of the number of individuals who may be likely to request self-determination, and that a process be identified by KDHE and KDADS to prevent children being removed from the autism waiver proposed recipient list without notification.
Questions on the IDD waiver? Senator Thompson and Senator Petty.
Not so much a question, but just a comment. I sat on that committee, and one of the concerns is the wait list from this IDD community is so long. In some cases, well over 10 years. And so by shifting to this 1915B waiver, it gives us more flexibility to be able to work these people in a little bit faster, also give the families a little more flexibility to, part of the problem is these families with IDD, they might get more services than they need when the child is in school, for example, but in the summer when there's two parents working, they need the extra support, it's not there, they can't get it. So one of the big problems is a flexibility issue with regard to that sort of stuff. So by changing this waiver, the hope was that it would give them a little more flexibility to deal with that. So that was just kind of a quick overview from that committee. But that was, the 3-day was just focused on how do we deal with this 4,000 or 5,000 people who are sitting on the wait list for services and using the limited resources that we have to fix their problem. Because to me, the IDD community is probably one of the most in need. They're the people who will never be able to take care of themselves, in most cases. So that's it was an interesting committee, but just wanted to bring you up to speed on that. Thank you, Madam Vice Chair.
Senator Thompson or Elizabeth, so you mentioned there's 4,000 to 5,000. Is that number increasing, decreasing? Is that pretty much how it remains over time? Can you kind of give us an indication?
It fluctuates between 4,000 and 6,000 roughly, and it depends on there are certain periods in time where the kids graduate from high school, and then all of a sudden they just sort of drop off. They are not eligible for certain type of services until they get to be a little bit older. And so we have to figure out how to close that gap as well. You might have somebody who's 21 years old, but they have the capabilities of mental capabilities of a 5-year-old or 4-year-old, so they'll never be able to take care of themselves. And we've got a bunch of different agencies involved. My concern is that you have some coordinating all of this between these agencies is a big part of the problem too. And the funding is there if we can just find it and just be flexible with the funds that we have to work with. So, but it's pretty stable between 4,000 and 6,000.
Thank you. Senator Petty, did you have a question?
No, but I did want to ask Elizabeth. I believe that at our last CanCare meeting that Sarah told us that we're transitioning to the from the 1115 waiver.
Yes, I believe that that's what she presented when she was here last week.
And that I think is already, so we have transitioned from the 1115 to the 1915B waiver.
Right, the committee their recommendation was to the executive branch to do that. In the report, that was their actual recommendation.
Yeah, I believe that was probably already in the works, because that takes quite a while. That was in the works before the committee, for the interim committee began meeting, because I've been sitting on CanCare oversight, and so she talked about that all last year as well.
Seeing no other questions, Elizabeth, you may proceed.
All right, so the last report is from the Special Committee on Mental Health Beds. Please note, this is not the final report and does not include all of the committee's activities. It is an updated report as of December 15th, 2022, entitled Updated Report of the Special Committee on Mental Health Beds to the State Finance Council. The report is a supplemental report to the initial report submitted to the State Finance Council in October of 2022. The final report incorporated a roundtable discussion to address the behavioral health workforce that occurred on December 21st, 2022 is still pending. In this updated committee report, states the committee was directed to review the need for inpatient psychiatric hospital beds and develop a long-term plan to address mental health needs, review the regional bed expansion plan and how the beds would be constructed, review best practice for providing the operation and oversight of the expanded beds, review the long-term fiscal impact of the additional beds, and study and develop a plan for providing a 50-bed facility with acute inpatient psychiatric beds and adult forensic beds in the Sedgwick County regional area. Note, provisions in the 2022 House Bill 2510, Section 8B, directed the legislature to create an interim study committee on Sedgwick County regional mental health bed expansion and prescribed committee membership requirements. The updated report lists 7 recommendations for consideration and did not have any items of proposed legislation at the time of publication. The updated report noted, the Special Committee on Mental Health Beds recognizes the need for additional beds and services for individuals who require inpatient care to treat mental illness. The committee recognizes that there is a current shortage of appropriate services for this population, which places stress on the staff and budgets of other community institutions, such as hospitals, jails, and community mental health systems. In addition to addressing the need for more inpatient beds, the committee recognizes the need to consistently staff these beds. Their recommendations as of December 15, 2022 were the following. The State Finance Council released the $15 million appropriated to KDADS for the purpose of opening a new state hospital. The funds should be utilized to develop a specific plan for the construction and operation of a new state hospital, including the issuance of a request for a proposal. Second, KDADS work with Sedgwick County to open a facility in the Sedgwick County regional area with a capacity of up to 50 state institution beds. The facility should be located in an area with room for expansion to ensure additional beds can be added if needed. The project should begin within calendar year 2023. In addition, KDADS and Sedgwick County should consider whether the facility should be publicly or privately operated. Third, the State Finance Council allocate $40 million from Federal American Rescue Plan Act, ARPA funds, to open the 50-bed facility as requested by Sedgwick County through the Strengthening People and Revitalizing Kansas, or the SPARK Task Force. The committee held a meeting with the Board of Nursing, Behavioral Sciences, Regulatory Board, Kansas Board of Regents, universities, community and technical colleges, state agencies, private colleges, and other stakeholders on a variety of topics, including ways to expand the mental health workforce. And that was that December 21st meeting that was held. The legislature appropriate up to $5 million to KDADS for each fiscal year to begin a 2-year pilot program to reimburse hospitals for the supervision and transfer of individuals who are waiting for a state hospital bed. KDADS should then provide the legislature with an annual report on how the funds are being used. The legislature, KDADS, and KDHE investigate available waiver and reimbursement options that can be used to pull down additional federal funds to reimburse providers of mental health services. And last, the legislature and KDADS research how technology, such as apps, can be used to reach those facing mental health challenges and investigate current practices being used to reach individuals in crisis via technology.
Thank you, Elizabeth. Questions from the committee? Senator Stephan.
Thank you. Was the committee tasked with looking at anything other than just beds? 'Cause I continue to struggle with the reality we have a very stagnant population, if not declining, and yet we seem to have this escalation in mental health disease, which is this committee tasked with looking backwards or in front of beds and what's contributing to the increase of the need for beds?
it's my understanding, I mean, based upon what they report, as they were simply looking at the bed situation.
Senator Petty?
If you look at the makeup, it's all Ways and Means and Appropriations. The makeup of the committee is all Ways and Means and Appropriation, if you look at the makeup.
Do we have any questions from our committee members online? Okay, any other questions? Senator Thompson?
Well, I think to dovetail Senator Steffen's comments is it would be good to know if committee is looking at this, the causes of these mental health problems and suicide, whatever. I mean, I think we heard something the other day about suicide. I believe it may not have been in this committee, but I asked the question, you know, what is the major cause? And they couldn't give us a definitive answer. You know, I think during COVID, the isolation could have fed into it, but there's other pressures going on as well. So, you know, to identify some of these problems, we have to understand the source. And just looking at the beds is only part of it. So I hope that in the future that they will look at that sort of you know, what is causing this problem? How do we fix it? Do we just throw more money at it by creating more beds? And just my personal comment. Thank you, Madam Chair, Vice Chair.
And if I can clarify, this is an updated report. It's not the final report, so the final report may have more insight.
Senator Petty?
I guess I might just add, unfortunately, we know this is a national problem. It's not just a Kansas problem. So we're seeing an uptake across the nation in mental health issues and suicide. So not to detour from what we're doing in Kansas, but I think we have to keep it in context of where the reality of what's happening in the United States and has continued to happen over time.
Senator, sorry, Senator, you're kind of the lone person over there, so
understand completely.
thank you for getting my attention. Senator Steffen.
Thank you. Well, and we do have to keep in mind that if we're only treating the end result, we're throwing a whole lot of money at a problem that's just continuing to dig itself in deeper and deeper and deeper. We know, most of us understand what the etiology of a lot of this increase is. It's a society that's moving towards godlessness and the breakdown of the traditional family, yet we don't take any steps as a government. We think it's taboo, which it isn't, to address the root of the problem rather than just the problem itself.
Okay. Thank you so much for those updates, Elizabeth. Appreciate it. Committee, that concludes the items on our agenda. We will meet Tuesday and Wednesday and Thursday. No meeting on Monday or Friday planned at this point. And God willing, we're hoping that Chair Gossage will be able to join us at some point next week. So with that, have a great weekend, and we are adjourned.